looked at reductions in maternal deaths, the deaths of mothers, and child mortality deaths, infants dying, children under 5 dying. And it was supported with a grant of 22 million euro, just under $4 billion.
Bless up, my people. Welcome back to the channel. It's a girl and Isabel Rose. Thanks for all the new subscribers. Thanks to the returning subscribers. If you're new to the channel, subscribe. Turn the post notification bell on. Put it on all so you won't miss an upload from me. On the road to 20k. Help me to get there, my people. Some people still on the matter of health as it pertains to, the People's National Party members calling for a health reform amidst the myriads of cries of persons losing their lives and their loved ones. And of recent, a lady who lost her mother and a mother who lost her 4-day-old baby. And so we're seeing them calling on Christopher TUFTON to basically improve the healthcare system. And he has been the sitting member of the Ministry of Health for approximately 8 years. And in basically coming out to people saying that the opposition are mischievous as they call for the system to be reformed. And that's his response. But I'm going to hear some more.
My team and I are going through the statement by the opposition and will provide a fulsome response on the issues. I just would like to say that there is a report that can be had to clarify any misunderstanding or address any mischief as it relates to the Promac program. The fact is that many hundreds of Jamaican mothers and their neonates who are involved in complicated pregnancies and delivery have been supported by the Promac equipment and where the buildings exist through the Promac facilities, and we can provide better particulars on that. And so the program has been quite useful to the Jamaican people. The issues around ventilators, given the public interest, we have done the audit and can provide better particulars on that and will provide better particulars. And the claim around health needing reform, I cannot imagine that any informed Jamaican, and particularly the opposition, where it should be their duty to see what is happening and understand what is happening, could be claiming that somehow the public health system has not and is not seeing the greatest level of reform since independence. 1,000 additional doctors, 1,500 new places for nurses, a permanent post, more build out of hospital beds, operating theaters than ever before, certainly since independence, diagnostic equipment leasing, which is leading to a more consistent and reliable outflow and use of diagnostic, and a primary healthcare reform that will see a life stage approach that will see over 370 additional doctors at the primary community level, as well as several additional services, not to mention the National Health Fund, which is prescribing some 3 million prescriptions a year from 1 million 4 years ago. More categories of illnesses is being added, subsidized prostate screening, breast cancer screening. So there is so much that this government is doing. And to hear the opposition make the claim that somehow the system needs reform without a recognition that the reform is in fact taking place, and tangibly so, where Jamaicans are benefiting, it tells me that they're either refusing to see or there's an attempt at mischief. And we will clarify that because I believe the Jamaican people deserve the truth and transparency around what is happening. So if we have to repeat it, we will.
Right after that, my people, we're seeing opposition spokesman on health, Mr. Dawes, came out and he provided proof, my people, of the government, mainly the Ministry of Health, receiving some little under 4 billion Jamaican dollars from the European Union to help with this Promac initiative.
Promac was a program for the reduction of maternal and child mortality. It was conceptualized to support the achievement of the Millennium Development Goals, which looked at reductions in maternal deaths, the deaths of mothers, and child mortality deaths, infants dying, children under 5 dying. And it was supported with a grant of 22 million euro, just under $4 billion. The implementation documents were signed from as far back as 2013. We, at that time, wanted to reduce the incidence of maternal deaths and child deaths through development of screening, but not just that, the availability of operating theaters, as well as ICU facilities or HDU facilities island-wide, so that if there's a baby who needed ventilation or a mother who needed ventilation, there would have been enough HDU spaces to accommodate them, at least for a few hours, until they could be transferred to another institution. And we know exactly where these HDUs should have been developed. Mandeville Regional Hospital should have had 3 maternal beds and 6 neonatal beds, plus 2 isolation high dependency beds. Victoria Jubilee Hospital should have had 6 maternal beds, 4 neonatal beds. Cornwall Regional Hospital should have had 4 maternal beds and 10 neonatal beds. With the Bustamante Hospital for Children, 8 neonatal beds plus 2 isolation HD beds. Spanish Town Hospital, 4 maternal beds, 6 neonatal beds, with an intermediate care unit capacity increase from 12 to 17 beds, with a minimum care unit bed capacity increase from 18 to 26 beds. St. Anne's Bay Hospital should have had 4 maternal HD beds and 6 neonatal high dependency beds. The pediatric unit should have been increased from 6 to 20 nursery beds. 2 operating theaters dedicated to the maternal patients should have been set up at St. Anne's Bay as well. Chapelton Community Hospital, Alexandria Community Hospital, Savlamar Primary Health Care Center, Mandeville Comprehensive Primary Health Care Center, and Nato Bay Primary Health Care Center, as well as the St. Jago Park Primary Health Care Center. So we know that the contracts were signed, we know that the money was allocated, and we know exactly where the high dependency units for mothers and children and babies should have been built out. The EU gave money then, and the EU gave money again during COVID, along with other Jamaican entities and individuals. And we are still left in a situation where there's a dire shortage of intensive care unit beds and high dependency unit beds for adults and neonates.
And so, with the country still lacking a whole lot of high dependency unit beds, same thing as intensive care unit, and ambulances, ventilators being short at some institutions versus others, and even trained personnel. What of those money? A whole heap of people I see in the last video when I do on the whole health saga asking where the money there, a whole heap of money the Ministry of Health get. So where is the money? And as he outlined, a 2 separate set of grants them get. So why aren't every hospital have at least 2 ambulances to transport patients that are in dire need? If there's one institution that doesn't have a particular, equipment, then transportation should be easily accessed to get them to another institution. But my people, wanna weigh in and tell me who wanna support in this whole saga. And as I stated before, I've been a midwife, still a midwife, not practicing right now, but I've had my fair share in the whole healthcare system. Was working at a prominent hospital in Kingston, and I started there at 2012 and I left 2017. And so during that tenure, it wasn't too bad. But the cries right now, it's in a deplorable state, and we can't shun away from that. And that's what the minister failed to admit. The messages I'm receiving, and we can even see some of it for ourselves. He says the reform has started. All right, we're seeing them basically painting, renovating some health centers, the whole Chapeltown area, amongst other health centers they have upgraded in terms of painting and refurbishing. But it goes beyond that. Painting the buildings alone and refurbishing the buildings is not it alone to say that it's being reformed. So it take couple billion well to paint the facilities them. I don't know, I don't understand my people. But let me hear what I have to say my people. Don't forget to like, share and subscribe to the channel, or run go over to my other platform, Instagram and Facebook, and follow me over there at Anisabel Rose. Check out the YouTube store, make a purchase, it goes in support of the channel. Check out the YouTube membership. You get a lot of benefits by becoming a member. Member shout out, member badges, only a small fee per month to join the Anisabel Rose movement. Thanks to all my returning subscribers. Thanks to the new subscribers. Thanks to my new viewers. Come on board, journey with me, join the family. Subscribe to the channel, like up the videos, share out the videos, support the ABR movement by playing a part. On the road to 20k, help me to get there, my people. Get this video to at least 2,000 likes for me, please. As I come up on the videos, then please to like and share. Stay tuned for more videos. Stay tuned for more updates. Big up on yourself.